On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. James Davidson, Dr. Charlotte Hodges, Dr. Colin Perro, Dr. Michael Musacchio. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Forest Park Medical Center is one of the top medical centers in all of Dallas-Fort Worth area.
Forest Park Medical Center, like you said, one of the best medical centers in the Dallas-Fort Worth area. Not only best staff, best technology, best doctors, like our first best doctor, Dr. Colin Perro.
For the last couple of years, I started having nosebleeds. They were never very severe. I went to the doctor a couple of times. We couldn't really figure out what was causing them. And then about 4 months ago, they became terribly severe and would last a half an hour at a time. And so I went to my internist who had me do an MRI and said, well, the good news is you have no tumor, but the bad news is you are not formed correctly. So that's when he sent me to Dr. Perro. One
of the newer technologies that we have the last few years to help people with not only nasal obstruction but with sinus infections and sinus problems is balloon sinuplasty. And balloon sinuplasty has been an excellent advancement in that it is a relatively less invasive or non-invasive technique to help open up the sinuses. I think I had just a congenital issue, and he said, I really want you to come look at your MRI. I said, but I have just a vessel, I want you to cauterize. And he goes, no, that's really not it. And so I looked at the MRI and it all made sense because I've never been able to blow my nose on the left side. Well, it's because that left side was almost completely closed. The way balloon sinuplasty works is if you have a sinus opening that is narrowed and usually congenitally, in other words, people were born that way, and then if they have a little bit of swelling, say in response to a cold or even a weather change or allergies, if you have a narrow opening, if it swells a little bit, it can swell shut. By placing a balloon into the sinus opening, we're able to inflate that opening and make that opening larger. If you then get the same amount of swelling from the allergies or cold or what have you, it's no longer swelling shut anymore and the sinus can continue to function as normal. Dr. Perro told me that he would go in and open up the left sinus cavity where it would actually drain properly and I could breathe through the left side. It was just so successful. It was shocking when I went for my follow-up visit and he took the packing out and said, okay, breathe through your nose. And I did, and it almost felt like I had too much oxygen. It's a huge difference. Dr. Perro was wonderful, and I would recommend him to anyone.
We're joined now by one of Forest Park Medical Center's founders and craniofacial plastic surgeon, Dr. David Genecov. Dr. Genecov, thanks for being with us today.
You're welcome.
If you would, start off by just talking to us a little bit about what brought you to practice medicine and specifically craniofacial plastic surgery.
I grew up in Dallas, and my father was an orthodontist here in Dallas, and he became part of the first craniofacial program down at UT Southwestern or Children's Medical Center in the late 60s, early 1970s with a physician named Ken Salyer. And so early on, I would see what my father did on the orthodontic side and still get to see what Ken did on the craniofacial side. And the transformations that the two of those guys did in the lives of children and their families I thought was extraordinary. I've always wanted to do craniofacial surgery. It's really the only reason I went into medicine, to be honest, was to be able to take care of these kids.
Wow, and talk to us about what is the most rewarding aspect of your job.
I enjoy taking care of patients from when they're small to when they're almost 18 years of age. I get to take care of kids almost for as long or longer than some pediatricians. Additionally, families move, but most of my patients, a vast majority of them, come back to see me on a yearly basis. So I get to watch them grow and see them mature over time, and I really enjoy that. The other thing I probably enjoy as much as anything else is the ability to take a child who otherwise has low self-esteem or the environment looks on them differently, and if there's something that we can fix or enhance or improve, we do that, and the change it makes in that child, both physically, mentally, and with their self-esteem, to me is life-changing for me, and that's the main reason why I do it.
That's wonderful. You've been an integral part of the development of Forest Park Medical Center. Talk to us a little bit about how you came to the vision of Forest Park.
The National Health Service model in this country is beginning to be pulled through the large institutions. So, in other words, the big institutions are beginning to control their entire referral networks by buying practices and employing physicians. And so I didn't want to be part of that employed service model for a whole bunch of different reasons, not least of which I feel it would interrupt the relationship that I have with my patients. And so if I'm employed by a hospital system, they have the right to tell me what to do and when to do it, and that's not what I wanted to do.
Well, thank you so much for your time, Dr. Genecov.
My pleasure.
And now we'll watch another Forest Park physician help change someone's life.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
I had some kind of a pain in my hip where I couldn't function as far as walking anymore. And I had been diagnosed back in like 2004 with an avascular narcosis. Sometimes I had real bad pain, sometimes it was just real minor pains, but I limped all the time. Everywhere I went, I limped. And then it just stayed that way. I never even actually went back to the surgeon again until last July when I had the infection take place.
On rare occasions, patients can develop an infection of any joint in their body. And so infection of a native hip joint is uncommon, but it can happen in people who have a little bit of arthritis in that joint and develop an infection in some other part of their body. The bacteria can find their way into the bloodstream, and then the bacteria can seed a joint that is a little bit arthritic.
With Dr. Casas, when I finally got in to see him, he had seen some results because from the previous surgeries I had an infectious disease control doctor involved. He read all the results and everything, and he admitted me into the hospital that following week for surgery.
Mr. Wiggins had developed an area of osteonecrosis, which means that the bone had died away, and this had occurred in his hip joint. And we really had no explanation for why the bone had died away. Mr. Wiggins subsequently developed an infection of his hip joint. He was treated with a prolonged course of intravenous antibiotics, but the infection would just not go away. So he was referred to me, and by the time I saw him, most of the cartilage in the hip joint had just been completely eaten away by the infection. Cleaning the joint out alone was not going to be sufficient to eliminate that infection. So I had to take Mr. Wiggins to the operating room. I opened up his hip joint, and essentially I started removing any bone that looked abnormal.
Overall, it was really great because Dr. Casas and all of his staff is really, really good. I'm feeling great. My leg is wonderful. I have no pain. I'm working again. I'm able to drive without having any pain. It's just been a wonderful experience.
Emily has a question for Dr. Dan Aldrich. The question, what is arthritis?
Arthritis is a very commonly talked about subject, especially because our population is aging, and as we age, more and more people will get arthritis. Arthritis is, when you break it down to the simplest form, a breakdown of the cartilage. Each of our joints has cartilage on each side of the joint. Cartilage is a very, very smooth and soft surface that allows our joints to move very smoothly and very nicely with no pain, with no difficulty, with no stiffness. When arthritis occurs, that cartilage begins to break down. It becomes rough, it becomes stiff, and then eventually it starts to disappear. And you hear the bone-on-bone situation basically means that the cartilage that was there is now gone. That cushion is gone. And now you have hard surfaces rubbing against each other, and this causes significant pain. The two most common types of arthritis are rheumatoid arthritis and osteoarthritis. And the main thing to know about those is osteoarthritis is just related to wear and tear, where rheumatoid arthritis is an actual medical condition that needs to be treated with medicines because it can cause severe joint destruction even at a young age. And there are blood tests to test for rheumatoid arthritis.
Did you know that Forest Park Medical Center was voted as one of the top 100 places to work in the Dallas-Fort Worth area? Forest Park Medical Center received this honor for the second year in a row.
This is what's called the Medtronic O-arm. It's a combination of traditional fluoroscopy with also a three-dimensional imaging component. Within 26 seconds, it will take 755 high-definition images. With the O-arm, we can actually take shots of the spine in a three-dimensional nature because the spine is a three-dimensional structure. And the value of that to a surgeon is that they can now see the spine in 3 dimensions and truly be able to determine with precise accuracy their placement of the hardware. The device also enables minimally invasive surgery. By more precisely placing the screws, he's going to be able to allow the patient to have a quicker recovery time and hopefully have a better quality of life post-surgery due to the more accurate placement of the hardware which the O-arm enables. We have the O-arm itself, which collects the images. We have the viewing cart, which the images are reconstructed on. And then we also have the stealth navigation image-guided surgery unit. After the images are recreated on the spinal navigation unit, the surgeon is able to bring different surgical instruments into the field that will help him more effectively place the instrumentation into the patient's back in a three-dimensional nature. And because this device is used intraoperatively, the surgeon can use the image-guided surgery unit to do the remainder of the case without additional radiation being delivered to the patient. The benefit of that is to the patient that they will potentially not need to be sent for a post-operative CT to check the final placement of their hardware, since they're able to do that real time in the operating room.
All of the doctors here at Forest Park Medical Center are dedicated to changing people's lives. Like our next best doctor is bariatric surgeon, Dr. James Davidson.
Why are people becoming more obese? Well, there's 2 things there. Is the culprit the knife and the fork, or is it the chair? Well, one of the things is that they've done studies, and they've shown actually our amount of food intake is decreasing or staying about the same since 1950. But what has changed since 1950 is our food source. We now have foods that have hormones in them, have antibiotics in them, and we have what's called a homogeneous sort of fat supply, a homogeneous sort of food, this genetically changed food. The next thing is that we definitely have decreased physical activity. One of the healthiest person 50, 60 years ago was a truck driver. Why? He loaded and unloaded this truck. Next thing is stress and distress. Do you think of times of World War I, World War II, people had to have a lot of stress or distress, or so are we having more or less now? I don't know. Another cause of obesity in this country is drugs. It's estimated that at least 10% of all obesity is due to drugs. And what are some of these drugs? Well, particularly some of the antidepressant drugs. It affects the brain. And you change some of these receptors in the brain that give people a good feeling. So they want the good feeling more from food or what have you. One of the big things that controls somebody's weight is the brain. We all eat almost the same number of calories each year. The average American only puts on about a pound a year. How can you put on such a small amount of weight of just simply a pound or 2 a year when you eat almost 1 million calories a year? Because that's the brain, due to these feedback mechanisms from your body's sensors. One of the sensors things is the leptin, a incretin released by fat cells that goes to the brain that controls how much you eat. So it's pretty amazing how well God designed the body, that considering how many calories we eat a year, how little bit of weight we gain. The brain and the body have this fantastic feedback between the two to keep people's weight approximately the same when you consider they eat about 1 million calories a year.
I'm currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time, as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extent that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
And for more information on Forest Park Medical Center, from staff to surgeons to technology, head to the website bestdocsnetwork.com and click on the Forest Park Medical Center tab.
And Jim, now we're going to head to our next best doctor who operates right here at Forest Park Medical Center. She's a general and bariatric surgeon, and it's Dr. Charlotte Hodges.
I saw Jamie in our office as a typical bariatric patient. She had a BMI of 42, really no other health problems besides her obesity. She'd never had surgery before, and she had no significant past medical history for abdominal pain or really any significant family medical history.
Before the surgery, I just wasn't feeling very good about myself. I didn't really want to go to the gym. I kind of just wanted to hang out at home and be miserable.
The first portion of the surgery that we do is we make our small bowel anastomosis. That's where we hook the small bowel up together. As I began to initially run her small bowel, the patient was found to have a really large mass at the base of her mesentery.
So when I was under for the gastric bypass, they were doing the surgery at the same time that they found the tumor in the small intestine. So they went ahead and continued with the surgery on the gastric bypass because the pathologist thought that it would be okay.
It really concerned me because when you have a mass like that, it could be a benign lymph node, but it could also be something more malignant. It could have been a lymphoma. I did discuss with the surgical oncologist at that time, should we move forward with her bariatric procedure in the event that it was lymphoma, and he reassured me it would actually be very fine, even if it came back, worst case scenario, came back a lymphoma. So we went ahead and we moved forward with the bypass.
So since surgery, I've been working out more. They do suggest 30 minutes a day to start out with, and now I love to go to classes. I've been doing Zumba lately, so that's been a lot of fun, and I don't think I would have done that before the surgery. My confidence is definitely up. I love hanging out with my friends, and I just feel better about myself.
Jamie's actually been doing very well since having her surgery. Her pain is very well controlled. She's been able to go back to work. She's tolerating her diet. As far as the mass, she's really had no other residual problems since removal of the mass. I don't anticipate her having any problems in the future either.
My friends and family have noticed a great energy change in me. I'll dance around the kitchen, and I'm always ready to go. Whatever they want to do, I'm ready to do it. And they call me a skinny mini now, so it feels good.
Today's Ask the Doctor comes from Mary. Mary has a question for Dr. Lowell Koo. My husband and I are trying to get pregnant. When is it time to seek a fertility specialist?
Many couples may wonder, well, after how long should I be worried that maybe something's wrong, and when should I see a doctor? Well, the true definition of infertility is when a couple has been actively trying for over a year without success, as long as they're under 35 years of age. If they're over 35 years of age and they've been trying for 6 months or greater, then they should seek help, and they would be considered to have infertility. So if you are under 35 and you've been trying for over 1 year, or if you're over 35 and you've been trying for over 6 months, it's time to seek help.
Today we are at Cowboys Golf Club, where we are holding the Bryan's House Charity Golf Tournament. We are title sponsors of this golf tournament and have been for the last 4 years.
Well, Bryan's House was established 25 years ago as the place for children with HIV and AIDS and for their families. And we've served that role for 25 years and continue to serve that role today. We provide childcare, we provide social services, we provide a range of support services for families facing that crisis. However, as the epidemic changed, we expanded our mission to take children with other special health needs. So now we take children with cerebral palsy, children with autism, children with breathing and asthmatic disorders, seizure disorders, just a wide range of other health problems.
The golf tournament does a number of things. Number one, it raises money for Bryan's House. And so we get sponsors from the community, both the business community, the medical community, to help sponsor the golf tournament and help pay some of the care costs over at Bryan's House. That's where the money goes, is to the care of kids. But more importantly, we have 90 some odd golfers today, and that's over twice as many as we had last year. And that in itself creates 90 more people who are prominent in what they do, leaders in the community in their respective businesses, and they begin to learn about Bryan's House. And they can help spread the word to other people that Bryan's House has a significant value for our community, and it's something that needs to be supported.
Forest Park wants to give back to the community. We're healthcare providers, so taking care of patients is what we do. It's what we do well. And although we're not all medically connected with this population of the children that are affected by HIV and AIDS, we also know that the community has, there's suffering that goes on, and that we should contribute in any way that we can.
We decided to have a lot of fun with it and put on some crazy loudmouth pants. So everybody's just having a good time. We have a lot of our staff out, a lot of our physicians out. It's just part of what Forest Park does, being involved in the community and being an active participant.
Forest Park Medical Center takes care of a lot of children. We take care of kids both at our Dallas location, our Frisco location, and soon to be the Southlake location. And taking care of children is important to us. We want to give back to the community and help Bryan's House gain some of that notoriety with the people with whom we work.
Don't forget, for more information on Forest Park Medical Center, from technology to staff to surgeons, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab. Now to our next best doctor, who operates right here out of Forest Park Medical Center. It's Dr. Michael Musacchio.
A very common patient we see is a patient who has lumbar stenosis. Lumbar stenosis is the most common condition that we treat surgically in any patient over the age of 55. But it can really happen earlier in life, even as young as the 30s. What stenosis is a series of changes in the spine that results in the nerves becoming pinched by disc bulging, thickened ligaments, arthritis in the joints. And as the spine becomes more narrow, the patient develops aching and pain through their back, sometimes through their buttocks and all the way down their legs. It can be very debilitating. It can affect the way they walk. It can limit their activity level, and it can be quite painful. With those patients, we like to follow a conservative approach, if possible using therapy, sometimes chiropractic care, injections, pain medications, and behavior modifications. But as the disease advances, might require surgical intervention. Traditional surgical methods can include open laminectomy approaches, which involve large incisions and muscle splitting approaches. They can be debilitating, painful surgeries. Newer advances and technologies in our field involve what we call motion-preserving technologies. These include such things as artificial disc replacement, and in some cases, interlaminar stabilizing devices, one of which is called a Coflex. The purpose of these products is we want to stabilize the spine and decompress nerves, but not necessarily have to fuse the spine or put screws and rigid constructs in the spine. We want to help the patient preserve their normal anatomy. The purpose of this is to help the patient's current condition of back and leg pain, but hopefully prevent problems in the future. With posterior approaches, we can use something called a Coflex or an interlaminar implant. It's a flexible titanium device that after we've decompressed the spine, we can place this in the back of the spine. It helps stabilize the spine, it helps preserve the patient's normal motion, it relieves the back and the leg pain, and ideally it will create more stable spines so that they don't have problems resurface in the future. Motion preserving devices are intended to decompress the spine and help back and leg pain, but by restabilizing the spine with the artificial disc type device, we're able to avoid fusions. The benefit of this is maintaining the patient's normal spine motion, and ideally down the road, they have less problems. Less need for surgery, less pain, and hopefully protects the remaining levels of the spine from degenerating in the future.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
We were going down a back road, and there was a group of dogs that I could see in front of me, but apparently there was one left behind, and it came out of my blind sight, and when I finally saw it, I swerved. And when I swerved, it slammed me into 2 oak trees.
When Brittany came in to see me, she had a profound hearing loss in that ear from the car accident. Something associated with the accident affected the continuity of the 3 little hearing bones in her middle ear.
When I was in the hospital bed, if I was laying on my left side, my right side I couldn't hear anything. I think there's something wrong because I could hear perfect. Now it feels like my balance is off. I can't hear y'all when I turn my head.
I tell the patient that they have an option to repair their eardrum and repair the hearing bones within their middle ear cavity. And I go over with them the anatomy of the middle ear, and I talk to them about the fact that a surgery can be performed to look into the middle ear, see what the problem is, and at the same setting to repair whatever it is.
Dr. Hahn knew exactly what he was doing, and he was taking it one step at a time. He wasn't, okay, well, this is what we need to do, and then we need to do it now. He was doing it step by step by step. And the first step that Dr. Hahn took was taking an ear test. And when he had found out how bad the results were, that's when we started taking more steps towards getting surgery done.
I lifted up her eardrum, looked into her middle ear, and it was apparent that the second hearing bone had actually been misplaced off of the third hearing bone. So there was no connection between the second hearing bone and the third. When her eardrum would vibrate, it wasn't vibrating into the inner ear at all. We actually replaced her second hearing bone with a prosthetic hearing bone, and within days, she noticed a significant improvement in her hearing.
Amazing the results that I had, and ever since after the surgery, I've been just upscaling from there. If I knew someone who was having the same problem as I was, I would definitely recommend Dr. Hahn. He's a great physician, and he sees you like you're a person and not just another patient.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center's, Jim, one of the top medical centers in all of the Dallas-Fort Worth area.
Exactly right, Candace. And for more information on Forest Park Medical Center, technology, staff, doctors, you name it, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
So long, everyone. We'll see you next week.